My name is Dr. Einstein Kibet. I'm a paediatrician, but also a maternal and newborn health expert, and I'm also the head of healthcare quality at Mwai Kibaki Referral Hospital. We understand that maternal health is a very important aspect currently, and we unfortunately we are still losing a lot of mothers from preventable causes, mostly bleeding, which is top, followed by hypertensive disorders in pregnancy, basically hypertension in pregnancy, and thirdly, infection. But hemorrhage, also known as bleeding after delivery, is one of the biggest killers, accounting for almost 70% of the causes of maternal death that we really have to think about how to deal with and fix it. Because we can't continue watching mothers die in this current age. Losing mothers is actually depriving families of livelihoods, and we have to take care of it. Thank you for that question. First of all, this is a little bit of a complex matter, but it can be addressed in a systematic way. So, if you look at postpartum hemorrhage or bleeding after delivery, there is so many things that can contribute to such an outcome or such an event. First of all, we usually put it in terms of what we call the pre-delay model. The first delay is when mothers are laboring at home and the families fail to make the decision to get them to a hospital on time. Case in point, you might find a mother who is delivering at out of a skilled birth attendant outside the hospital, probably with a birth attendant, a traditional birth attendant that we see sometimes, or they're just laboring in the house, but the household has not yet made the decision that this mother actually needs to be in a hospital. That delay significantly affects the outcome and can actually lead to death if a mother is bleeding. The other delay is after they have made the decision they want to go to the hospital. How quickly can they get to the hospital? Do they have the necessary transport to get them to the hospital? Do they have means? Can they afford transport? Is ambulance services available to get them to the hospital? If there are, you see mothers get to the hospital on time and they can actually be saved. Unfortunately, you might get in areas in this country, such like the arid and semi-arid areas, you will find access to a hospital might be quite far away, and ambulance services is not available. So due to these inequities, you will get mothers delaying to get to hospital for their timely interventions to keep them alive. And unfortunately, when they get to the hospital, they have bled a lot, and that can actually contribute to a death, which is very unfortunate. So the third delay usually happens when mothers sometimes get to the hospital timely, unfortunately, or even delayed, but still alive. Unfortunately, when they get to the hospital, you find there is systematic issues within the hospital. For example, you lack drugs to give the mothers, you lack blood to give the mothers who require blood, or the medicine sometimes probably of poor quality standard, or you do not have sufficient number of healthcare workers to attend to the mothers. For example, if you get two emergencies running at the same time, and for example, just picture you have two emergencies, two mothers bleeding, one theater space, definitely you put the life of a mother at risk. So these are some of the issues that can happen within the hospital. And that's the third delay within the hospital facilities that could actually lead to poor outcomes of the mothers who are bleeding. So if you look at these 3 points of delay, these are the areas where if you are going to fix the problem, you start dealing with them at those levels. So first, at the community, are you getting families where mothers are making the decisions on time to get them to the hospital? Second, how will we make sure that we need to make sure that mothers, after a decision has been made for them to get to the hospital, they're getting to the hospital on time. So they must be empowered enough. There has to be ambulance services to get them to the hospital on time. And third, within the hospital setup itself, we need to have sufficient healthcare worker numbers with sufficient drugs, equipment to make sure mothers are surviving once they get to the hospital. So those are the things we need to look at. Indeed, you've pointed it out correctly. There is a looming crisis for healthcare worker shortage, but good thing, we still need to appreciate that the evolution in Kenya, we have the health system in Kenya is actually devolved. So power is with the counties. It's not all gloom, in my own opinion, as it stands now. First of all, I want to believe the momentum currently is maternal health is a big issue, and we have to fix it. And governors have actually acknowledged the problem. I've had like the Council of Governors, the chair of the health committee, talk about it before, about his own county. That is the Honorable Mudhomi Njuki. Mudhomi, yes. Now, are we there yet? No, we are not there in terms of numbers. Governors must rise up to the occasion and employ healthcare workers. There is no definite shortcut for this. They must do it. If we don't do that, we will not achieve what we need to achieve. We have to employ healthcare workers. We know over the years, there has been substantial increase from the numbers that are usually put forward from the Council of Governors of an increase in the number of nurses. But however, it's not yet enough. Unfortunately, we still have highly skilled workers from Kenya. If you look at nurses, the highly skilled ones, the ones who are the best, are actually being poached by foreign nations. People are going to Australia, United Kingdom, Canada, the United States, and these are our best brains. So the problem is you might get others coming into the system, but the highly skilled and experienced ones to teach those ones who are coming into the system how maternal health is handled are being lost through brain drain to other countries. And this is a very big risk we are actually going through. So I would really encourage all our leadership from the National Ministry of Health, the county governments, to try as much as they can to retain their top brains in the medical field. Nurses, doctors, clinical officers, everyone involved in caring for mothers. We need to figure out a way of how to retain them. Otherwise, at this rate, even though we'll be replacing those who are leaving, we will not catch up with the quality, because all those who have learned how to deliver the quality care to the mothers are actually being shifted off to other countries, and this is not good for the country. The quality of referrals. Thank you very much. Now, regarding the quality of referrals, that touches on largely, I would really say, largely healthcare worker factors. What are we doing about this? If you realize, currently we are doing a lot of trainings on emergency obstetric and newborn care. A lot of mentorship is going on to try and address this problem. So you will find groups. There is various groups of professionals that have actually caucused to try and fix this problem. So how do you improve the quality of referral? First of all, is to make sure that everything that the healthcare worker requires is available. We will train them. Training is actually ongoing. So we are certain that in terms of building the skills of healthcare workers, in terms of training, that is being addressed. But it has to go hand in hand with equipping them with the tools they require to give the best available care for their patients. So it is I still say it is multi-sector. It is multidisciplinary approach, multi-sector. So government has its role, the healthcare worker has its role. The healthcare worker, we are training them on the skills they need. And this is actually ongoing, government-sponsored, but largely also by partner sponsorship. There's a lot of partner-sponsored programs to capacity build healthcare workers to make sure the quality of referral is actually being beefed up. And specifically for postpartum hemorrhage, you will hear of something called a uterine balloon tamponade. This is one of the things that has been actually innovated to try and keep mothers alive, mothers who are bleeding as a result of the uterus not contracting the way it is supposed to. They use something called a uterine balloon tamponade to help them keep a mother alive from a lower level facility to a higher level facility. And this training is actually going on almost everywhere in this country. Okay. However, we still need to figure out how to make sure the healthcare worker is making the decision at the right time by doing continuous mentorship. And this is one of the best ways that will actually help us improve the quality of referrals. So you're asking if a mother can know if they're entering a danger zone. Okay. So whatever you've had throughout the presentation, antenatal care, first of all, is always important. Remember, during antenatal care, we usually inform the mothers of something called danger signs. And if you look at the booklet, there is a booklet we usually give the mothers in the antenatal period. It's called the Mother and Child Health Booklet. It's usually purple in color. If you flip through the pages of that book, you will see a whole page labeled danger signs for the mother. So what we need to do is to make sure all mothers understand what is on that page in a language that they're familiar with. So it will tell you about bleeding, if probably that the water is broken early and you're seeing gush of fluid, if you have pains that are not stopping, if you have bleeding, I see that. If for example, you feel the baby is not kicking well enough, these are some of the danger signs that a mother needs to report. Or if you have severe headache, or if you have vision that is blurry, these kind of things, you'll find them on the book. So what we are supposed to do is empower the mothers. This is the information they need to see, to get. If they see any of that, they are supposed to be in the hospital immediately. Once they are in the hospital, usually the doctor or the midwife will ascertain the situation of the mother at that point. And if the mother is in danger, intervention shall be put timely to try and save her life and her baby's life. If she will be stable at that point, she will be kept under observation, but those danger signs will still be emphasized to her. Okay, same things. If she sees it's worsening, for example, baby is not kicking well, or there is increasing in bleeding, or there is more drainage of, like the waters are breaking and a lot of fluid is gushing out, or they're having severe headaches, or they're having blood vision, that the ones I mentioned. If any of these are seen, the mother is usually told, any of those things that you see, you have to inform the doctor or the midwife. Something else, even at the community level, I've not really mentioned this, but there is the community health promoter who we know is supposed to follow all pregnant mothers at that level. And their role is usually to also continue educating them about these danger signs so that the mothers can actually make the decisions timely in case they need to be seen in a hospital, so that you get them on point at the right time, prevent a catastrophe.